Hello again everyone, Dumelang. Welcome to another episode of the Sports Health Corner, where we answer all your sporting medical questions. Remember to go to our Facebook page and like the page. Remember also to subscribe to our YouTube channel and enjoy what you see there. You've seen probably the last 3 episodes, and I hope you enjoyed it. My name is Matlhomola Morake, and I'm once again joined by our resident doctor, Dr. Thulani Ngwenya. Welcome, Doc. Nice to see you again.
Thank you, Shok.
We're tackling another topic.
Yes.
A very difficult one, I must say. Sudden cardiac arrest.
Sure.
And I know there are many questions some people would love to know about sudden cardiac arrest. Tell us, Doc, what is sudden cardiac arrest?
Yeah, thank you very much for the question. It's quite an interesting topic because now it mostly talks about death, arresting of the heart, which will eventually cause death within a short space of time. So now when you're talking about your sudden cardiac arrest, I'm gonna break it down again. Sudden is something that happens just like that, without warnings. It just happens without warning you that, hey, something is going to happen. It's sudden. Cardiac is the heart. Arrest is when your heart stops functioning. So sudden cardiac arrest is an abrupt, it happens there and there without warning, and it stops functioning. So that is sudden cardiac arrest.
Would I be wrong if I associate it with heart attack?
Yeah, well, it's quite interesting. I'm glad that you also raised that. You know, a lot of people always think that sudden cardiac arrest is heart attack, and it's not true. Sudden heart attack can cause your heart to arrest, but cardiac arrest cannot really cause a heart attack. Now,
Doc, wait.
Yeah.
I think you have to say that again.
Yeah.
Heart attack does what, and sudden cardiac arrest does what? Please, be very clear there.
Yes. So, heart attack can cause your heart to arrest, but a cardiac arrest can really not cause heart attack. Let me further explain. Now, with a heart attack, now I need to explain a little bit about the heart. We all know that the function of the heart is to pump oxygen to the rest of our body, but I mean oxygenated blood to the rest of our body. Now, the heart, what it does, it receives deoxygenated blood that does not have good oxygen, that does not have oxygen, devoid of oxygen. It receives the oxygenated blood, and then that blood is filtered through for gaseous exchange between the lungs and the heart, and then that blood comes out back to the heart to go to the rest of the body. Now, that is the function of the heart. But for that to happen, the heart also needs oxygenated blood. So the small vessels that are supplying the heart muscles for it to be able to function, those vessels are quite tiny. So because of those vessels being very, very tiny, they can easily block, especially when you've got high cholesterol. High cholesterol can dislodge, and then it can block those tiny vessels. So then when those tiny vessels are blocked, then it is then what we call heart attack, because those tiny vessels are blocked. They are not supplying the heart, and the heart can then, because it's suffocated, it can't really function properly. And then because there's no supply of oxygenated blood to that heart, then the heart will stop functioning. We said arrest is when the heart can't function. So then this is now the heart attack causing cardiac arrest. So it can be also sudden. But with the heart attack, it does give you some warning, because it will say there's serious excruciating pain that you are feeling because of these tiny vessels. So it does give you a warning, unlike your other cardiac arrest that will happen abruptly without warning, like your myopathic hypertrophic cardiomyopathy, where you've got your heart muscles, because the heart on itself is a muscle. So with a muscle that is overly exercised, it's just like lifting weights. When you continually lift weights, then your muscles will start bulking up. Even with your heart, when you are exercising, you are you are doing some activity. So your muscle will then go to some sort of swelling or some sort of atrophy. It atrophies, and when it swells up, then it will affect how it normally functions, because now it has swollen up. It doesn't pump out the right way that is supposed to. So those are the types of cardiac arrest that you may get. But with the heart attack related one, it does give you warning, but the other one does not really give you a warning.
So speaking of warning, are you saying a person that is struck by heart attack has a better chance of survival than a sudden cardiac arrest person?
Yeah, well, when you have got a heart attack, it is excruciating, but you have more time to actually deal with it. It's a medical emergency. You need to go to hospital ASAP, but you have more time. With cardiac arrest, your heart stops pumping. It means that all your essential organs cannot be fed with oxygenated blood, including your brain. Now, science has taught us that you need about 3 minutes, a period of 3 minutes where you do not have your brain being fed by oxygenated blood. So if you are more than 3 minutes of not feeding your brain with oxygenated blood, then you suffer what we call brain death. And when you are brain dead, you are actually dead. So with cardiac arrest, because there's no pumping of this oxygenated blood to the brain, then unfortunately you are at risk of dying within a short period of time. But with heart attack, you need your heart. It's an attack, and your arrest, it can't arrest immediately because you've got time. There's some fluid that is still going past this tiny vessel, even though there's this blockage. So you can still buy time there, and because there's still some supply to you, and your heart hasn't stopped function. It has to suffocate for some time for it to stop functioning.
So now, Doc, we've been told that we must hit the gym, we must exercise, but it seems the sudden cardiac arrest hits fit athletes. How is that possible?
That is why in our second episode, we spoke about pre-competition or pre-sport assessment. It is critical, it is key, that it does not mean that when you're healthy, everything is fine with you. I'm just going to make an example of HIV, for instance. I can be physically fine. Everyone would look at me physically fine, but I'm HIV positive. So with doing proper screening, it makes you to rule out the risk factors for you to develop cardiac arrest. For instance, we're gonna know the condition of your heart, and we're gonna know if you've got a valve problem in your heart. We're going to know if you've got a problem with big heart muscles. We're going to know if you've got a problem with electrolyte imbalance. You know, you've got a channel, your calcium channels that are in charge of electricity of your heart. If there's a problem with that, then we are able to address that as early as possible. So when you do pre-screening, then you are able to rule out and make sure that all those things are attended to. That is why you then minimize the risk of cardiac arrest. But we see quite a lot of athletes that really do not do proper screening. And then a person would be surprised, but why did this person suffer a cardiac arrest if they are fit? Because we are told to exercise and. But it's because they did not do their screening properly. That is why the second episode was quite essential, that everyone, whether you're an elite athlete, whether you are a weekend warrior, it is important that you do your proper pre-sport screening.
So from that point of view, it is preventable.
Not prevent. I can't really say it is entirely preventable, because in medicine there is nothing that is 100%. You can do, when you are doing the screening and everything, you are minimizing the risk, but you are not entirely taking it out, but you are minimizing it. So when you have screened, you are better off than a person that hasn't screened.
So Doc, a match is taking place, and a player falls without contact. So how do you then evaluate? How do you suspect that could be sudden cardiac arrest?
Yeah, most of the time sudden cardiac arrest happens without contact, and most of the time it happens where action is not taking place. Most of the time, because it just happened. And again, you see, a heart can also arrest when there's trauma on the chest, when there's a big blow on the chest. A heart can still arrest because of that. But most of the time, we see it happening, a player suddenly falling without any contact. That is why you need to be vigilant as a sports doctor for that particular club. So what you do when you see a person falling down without contact, it is sudden cardiac arrest until proven otherwise. You rush into the field immediately without warning anyone, without even warning the referee. So what we then, because some people might use that in sport to use it as some way of stopping the game or disturbing the flow of the game. But what we then do, we because then referees, they do not know as well. So, but there's continuous talks with them to tell them to watch out for cardiac arrest. So what we then say, we say because there's a physio and a doctor, the physio must go and just flag up onto the fourth official that he's rushing because he's suspecting a cardiac arrest. When you go there immediately, you start doing compressions. Now, when doing CPR,
compressions will be CPR.
Yeah, compressions is starting CPR. But when doing CPR, because we want to manually pump the heart, because the heart has stopped functioning, so you want to manually pump the heart. So in sport, we are taught when doing CPR, the approach is to do A, B, C, A being the airway, breathing and circulation. But in sport, we overlook A. We change the order to be C, A, B. You start by checking the circulation because the problem is an arrest, so you need to pump so you check the pulse first. But under normal circumstances, you still have to start by listening and feeling for any breathing. But with a sport person, why is the order changed? It's because this is a person that has been running. Most of the time they are hyperventilating, they're breathing fast. So you can't really be worried about air coming in and out. So what you are worried about is circulation. That is why first you go and check your pulse if there is a pulse. If there's no pulse, then you start your compressions doing CPR because you are manually compressing the heart because I carry the heart pumps. Mm-hmm. So you are manually pumping the heart while buying time for an automated external defibrillator to come because you need it to actually give the electrical charge for the heart to actually start. That's the only device that can actually help you on the field. And then once you get the heart restarted again, then you can send to hospital for further evaluation.
So from what you've just told me, you're saying that the medical teams on the benches, you don't just follow the actions like us fans, but you have to actually have the full view of the field.
Yeah, when you're doing sports medicine, you are also taught that skill, that you don't, in fact, mostly sports medicine, especially the emergency part of sports medicine, we are taught that when you are a sports physician, you don't watch the action. You must have the full view of the whole pitch because your responsibility is to save life, is not to watch the game and enjoy the game. So your responsibility there is to make sure that the health of everyone that is in your game, especially your players, is taken care of.
Now I want us to go back to the point that you made earlier about getting there and start with the compressions. Now what happens going forward? If the person is revived,
yes,
do they continue playing?
Yeah, no, for a cardiac arrest you can't take a risk. So when they start breathing again, you need to take them out. They go to the ambulance and they go for evaluation by a cardiologist in hospital. So you can't really go back and say, they say no, but because now they are breathing again, then they need to go back. You can't take that risk because you're dealing with the heart, and your heart, if your heart is not functioning, then it means that your brain will be affected. And if your brain is affected, then there's no life.
We know that the danger thereof is death. But now, if they survive, they go to hospital, they check by a cardiologist, can they come back and be active in the sport?
I have not seen anyone that has survived a cardiac arrest going back to playing again. Because now that's when you determine that, there's 1, 2, 3 that could have been risk factors that could have caused that person to have sudden cardiac arrest. And then you wouldn't, if then there's a heart abnormality, then you wouldn't want them to exercise, because when they are exercising, they are stressing their heart. They are stressing their heart muscle. So when they're stressing the heart muscle, then it might make them then to be at risk of developing a cardiac arrest. They might not be so lucky again when it happens again. So most of the people that have suffered cardiac arrest and that we have records of have not survived. Most of them have died because of how we reacted towards the arrest. But now we are more vigilant. So those that have survived it, which are very, very few, have not gone back to playing again. In terms of picking up heart condition, there's nothing that is 100% in medicine, like I said. When we are screening, we are minimizing the risk. So sometimes when you are doing ECG, for instance, the ECG for an elite athlete is abnormal. So when you read the ECG for an elite athlete, a person that is elite, ex-elite athlete, most of the time, the ECG is abnormal. Now, you need to also understand that you would have an abnormal ECG. That is why when you pick up an abnormal ECG in an elite athlete, you don't stop there. You have to do further evaluation, like do an echocardiogram. Now that's why even when doing PCMA, you don't stop at ECG. It's compulsory to do an echocardiogram. That's further evaluation, not done by not only you as a sports physician. It is also done by a cardiologist, but a sports cardiologist. Because even in cardiology, the readings or the heart structure of a normal person and a person that is an elite athlete is different. So you need to go to a sports cardiologist so that you determine that, and then you can then come up with the right thing. So it is bound to happen. It is bound, because if I can take an ECG of an athlete right now and give it to a medical student, or even say an intern who is a doctor but an intern, and say, what do you think of this ECG? And I don't tell them of the history that this is an athlete. They would say this is an abnormal ECG based on 1, 2, 3, and 4, because it reads abnormally because of the action of the heart muscles. Remember I said when you are exercising, you are actually stressing the heart muscles. So the ECG will actually come out different.
Well, Doc, that's where we'll leave it for today. Another informative session, I must say. And thank you very much for joining us. And you, the viewer, go to our Facebook page and like the page. Also, subscribe on our YouTube channel and enjoy what we've brought for you. We'll meet again in the next few episodes. And if you have questions or comments, as I said, don't hesitate to drop us a line. Give us your questions, give us your suggestions, give us topics you'd like us to cover, and we'll gladly do so. If you want to pay Dr. Thulani Ngwenya and his team a visit, do so. Go to our Facebook page and you'll find all the details there. Give them a call and make a booking, and they'll gladly assist you. And remember, we are the Sports Health Corner. We answer all your sports medical questions. And don't forget, this is my show, this is your show, this is our show. Until next time, stay safe, stay injury free. I'm Matlhomola Morake, and I'm out.